So welcome to our summit, Health and Economic Development. I am Mona Fouad. I'm a professor of medicine and director of the Division Preventive Medicine and Minority Health and Health Disparity Research Center. I'm also leading the initiative that is behind this summit, the Reach Across the U.S., which is a CDC-funded project that through this project we were able actually to reach the community, and the coalition of this project, this summit was actually their idea. Our coalition and our grassroots, when we talked with them and talked about health disparities, they said, you know, we've been talking about health disparities for a long time, but if we don't address economic development and the viability of the communities, we're not going to be able to address health disparities. So we can't separate viability of the community and healthcare access and education and poverty and unemployment. We can't separate all this if we really want to have healthy communities and healthy economy. So that was actually the idea behind this summit. We're very excited about this because it's a new approach. I do a lot of work in the health field, but economic development, it's new to us. So we approached our partners and our colleagues and outstanding panel that you're gonna hear from today that they worked in these areas. So we can see how we can together come up with models or ideas for the state of Alabama. And again, this summit, I hope that it's not just a one day, it's a beginning of a process. We're hoping that by the end of the day, we focus on 2 or 3 things that with some of your help of the people that are gonna be here today, we can maybe hopefully in 6 months come up with an action plan that we can give our policymakers to see and our business people and challenge people to say, can we do this? So I'm looking forward to this meeting today. Again, we have a small audience because you were handpicked. We did not open this for registration. It was by invitation only. And we have people representing policymaker, our officials, elected officials. We have people representing the business community. We have our state health department. We have foundations. We have academic institutions. And we also appreciate the UAB leadership for supporting us for doing that because they're very, very committed to this meeting. And I appreciate Dr. Garrison's time. You know, she helped me too when we were trying to put the agenda, gave me guidance of how we can shape this. So we are committed to that. So to move forward with the program, I'd like to introduce 2 people that their involvement and their support has been very, very essential to our work in the health disparities field and also in co-sponsoring this meeting. We're going to hear some welcome remarks first from Ms. Lisa Roth, who is the Chief Executive Officer of the American Cancer Society Mid-South Division, and then going to be followed by Dr. Leander Liebert, who is the branch chief of the Community Health and Program Services Centers of the Center of Disease and Control, which actually funds the REACH US. Lisa.
Thank you, Mona, and good morning. I too would like to welcome you all to Birmingham. Birmingham not only is the home to UAB, but it's also the home to the American Cancer Society Mid-South Division office. The Mid-South Division is the part of the American Cancer Society I'm responsible for, and it includes 6 states, 6 southern states, which of course is Alabama. It also includes Arkansas, Kentucky, Louisiana, Mississippi, Tennessee. And there's 6 wonderful states, but 6 states that have the highest cancer incidence and cancer mortality rate in the country. So that's the reason why we're here and why Mid-South Reach US Seed Partnership with Minority Health and Health Disparities Research Center and with UAB's Comprehensive Cancer Center is so very important to the American Cancer Society. This initiative speaks to the very heart of our mission to eliminate cancer as a major health problem. And we, along with everyone else in this room, are truly committed to addressing complicated root causes of health disparities among many of our populations. And most importantly, we are looking forward to the day when disparities in healthcare has been erased in our geography and when we can serve as a beacon for the rest of the country. So I thank you for being here. I thank you for your interest, and thank you for helping us with our vision. And last but not least, I'd like to express my gratitude and appreciation to CDC for their funding of this most impactful work. So again, thank you for being here, and I'll welcome Dr. LeBird to the stage.
Good morning, and I want to first of all congratulate Dr. Fuad, Dr. Partridge, and Dr. Nguyen, as well as all of their colleagues, partners, and community advocates for having the vision and indeed the courage to champion and sponsor this dialogue on economic development and health. In public health, we've known for over a century that there is a strong correlation between the economy and the population's health. And as we are, as a nation, part of a global economy, health inequalities are a global phenomenon. And those of us working to eliminate racial and ethnic health disparities, as has already been mentioned in this country, are keenly aware that communities of color are overrepresented among the poor and the under and unemployed. And this is one of several root causes of health disparities. I speak for my entire division when I say that we couldn't be more excited about today's summit and the opportunity to participate. Relatively few communities around the country would be able to host a forum with all of the distinguished speakers we will hear from today. But the fact that this is happening here in Birmingham is just another reflection of the leadership that we've come to expect from the REACH program here at UAB. Thank you for allowing me to bring greetings from CDC and the REACH US program, and also for the opportunity to spend the day with you to learn. I look forward to taking recommendations that will come out of this summit back to Atlanta. Continue to do what you do, and I believe that the entire nation will benefit. Thank you again.